It's time for another installment of Flashpoint. This week, anchor Kirsten O'Connor talks with guests about medical marijuana legalization in Florida.
Good morning, I'm Kirsten O'Connor. Welcome to Flashpoint. Medical marijuana is now legal in the Sunshine State, and if you're one of the Floridians who need it for health problems, there are many questions on how and when you can gain access to medical marijuana. Joining us today on Flashpoint, Dr. Laura Brown, a certified medical marijuana physician and owner of Access Marijuana RX.
That's correct.
And we have Kim Rivers, CEO of Trulieve, which is a Florida dispensary organization, correct?
Correct.
And so let's talk about that distinction a little bit. Sure. What does that mean to be a dispensary organization?
So as Florida's first licensed medical cannabis dispensing organization, we actually cultivate, process, and distribute medical cannabis in the state of Florida.
Okay. And from a physician's perspective, what does this mean for people who are starting to learn these different titles and different types of stores that they haven't seen pop up before?
Sure. What it means for the citizens of Florida is that they need to understand that under the current existing laws, there are 7 dispensing organizations that have been licensed in the state of Florida. So there are 7 sources of medical cannabis for those patients. The patients then can investigate the products offered by each of those dispensing organizations, which vary somewhat.
Right. Okay. And so those are official places.
Sure.
Those 7.
That's correct.
Okay. Let's also talk about and start this by talking about Amendment 2. It was defeated on the ballot in 2014 by a pretty slim margin. And then in our most recent election, it passed. It got over 70% of approval by voters. So why do you think voters are changing their minds? Let's start with you, Dr. Brown.
Well, I think it has to do with education. I think the citizens of Florida are smart. They've educated themselves, and they've actually watched what's happened in states around the country that have already passed and enacted medical cannabis. They've seen the benefits in those states, and they've told the legislators clearly that they want access to that therapy for their loved ones and their family members and their friends and themselves.
And do you think that there was anything to do with this recent election that changed voters' minds?
Well, what I can tell you is that the ballot language did change somewhat from 2014 to 2016, and I think that Dr. Brown is correct in terms of voter education. And the main points of change were there were clarifications around minor access. So I think that was a big, maybe unknown issue going into 2014. Also clarification related to the debilitating condition, so people could see and associate, okay, we're talking about very serious medical conditions here. We're not talking about a general recreation / medical light law here. It is really medical in the state of Florida, and I think that put a lot of people's fears at ease. And I think that in general, again, with it's a trend nationwide. We're one of many states who now have some form of medical cannabis laws on the books.
That's right. So the big question for a lot of Floridians now is when and how can you get medical marijuana? Let's start with you.
Sure. Well, it starts with the physician-patient relationship. So, the first place that a patient needs to go is to find a licensed, certified physician who has an active practice in this field. It is an emerging field, and I do urge patients to do their research on the physician, because it is critical that physician not only has access to the registry, which we can talk about, but also has great training and information about the use of medical cannabis for that particular condition. So it starts with going to the physician. A physician will then place the patient in the compassionate use registry, and so that patient will have an order at that point. Then, as Dr. Brown suggested, that patient can research which dispensing organization they would like to receive their medication from. They come to us, we verify they have an open order, we verify the dosing, which the physician provides to us, we also verify the route of administration, which the physician provides to us, and then they fill their order, very similar to a typical pharmacy transaction.
Which makes sense. All right, we do want to talk more about that access, and we have a physician right here to talk to about it, but we're going to wait until after the break, and we will be back here on Flashpoint. Welcome back to Flashpoint. Today we are talking about medical marijuana legalization and what is next for Floridians. And earlier we were talking with both of our guests about who has access to it. I want to talk to Kim, though, about Trulieve, because it has one of the very first dispensaries in Florida. So let's talk about how they work.
Sure. So Trulieve is an organization that was granted a license by the Florida Department of Health to both cultivate, process, and distribute medical cannabis. And so we operate within an 80,000 square foot facility in Quincy, Florida, which is about 30 miles from Tallahassee. We grow in completely indoor, climate-controlled environment. We are pesticide-free, and we do all of our manufacturing in-house. So we have a variety of products available. In Florida, it is illegal to smoke cannabis, so we offer an inhalation product through vaporization. We offer a capsule product. We offer tinctures, which is a sublingual product. We offer an oral syringe, which is a very concentrated, highly potent oil. And then we also offer an additional type of vaporizer, which is an herb vaporizer, which is a whole flower product for people that want to have the entourage effect, which is an effect that is beneficial for patients that want to have all of the cannabinoid profiles, not just a THC or a CBD product. And then we also have dispensaries. We currently have 2 dispensaries open, one in Clearwater and one in Tallahassee. We have another dispensary in Tampa that's going to open in a couple of weeks. And then we have one on the books for Orlando, Jacksonville, Miami, Bradenton, St. Pete. So lots of dispensaries coming online soon.
Right after the recent election. Makes sense.
Correct.
So Dr. Brown, you're the owner of Access Marijuana RX in St. Petersburg. Let's talk to you a little bit about what services you provide and access. Who has access to medical marijuana?
Well, right now, especially with the passage of Amendment 2, many patients have access to medical marijuana. I mean, it's estimated nearly 2 million people are potentially qualified to receive medical marijuana in the state of Florida. Patients who have access are those that meet the debilitating conditions listed in Amendment 2, and those include things like ALS, multiple sclerosis, glaucoma, PTSD, HIV/AIDS, Crohn's disease, and of course the original diagnoses of muscle spasms, seizures, and cancer. But there's a clause in the amendment that also allows some discretion by the physician caring for the patient. So the clause says roughly that any other medical condition that is of equal debilitating condition, a physician may choose that that patient is qualified as well, as long as the risk do not outweigh the benefit of the therapy.
So there's a little bit of room for the physician to actually make that decision with their patient.
Absolutely.
Okay, so how do patients find these doctors who can help them gain access?
Well, right now in the state of Florida, there's roughly just under 300 physicians that have gone through the certification process. Unfortunately, not all of those physicians have the same breadth of knowledge. But if a patient were looking for a physician who is a qualified physician to prescribe medical cannabis, I would suggest they start with the Department of Health, Department of Compassionate Use, where all the physicians that are currently licensed are listed.
Okay, so you can just look it up.
Yes.
It's that easy.
It's that easy.
So what are the benefits and the side effects or warnings?
The benefits are enormous. I mean, I wish that I could bring patients for you to talk to, because the patients we have who've responded favorably, it's been life-changing for them. I mean, you talk about patients with multiple sclerosis who are now able to walk better and get out of the house. You're talking about patients with Crohn's disease who are able to function without pain. Terminal cancer patients who have some quality of life before death. So, you know, the benefits are just enormous. There can be some negative effects if the patient, for example, uses too much or advances their dose too quickly. It's an emerging field. There's a lot that we don't know about cannabis therapy at this time. We're learning quickly. The field is evolving rapidly. That's another thing to take into consideration when you're choosing a physician to monitor your care, is that you choose somebody who is keeping up with the science as it develops.
And I want to mention one of the things that you brought up too, and that is that smoking is actually illegal still.
Correct.
So that's something maybe people don't realize when they hear marijuana is now, medical marijuana that is now legal. So how are patients able to use medical marijuana?
So again, there's a number of different delivery methods, and it really depends on the diagnosis and the conversation that the patient has with their physician. Everything is dosed in active ingredient milligram dosing, so it's a very specific, very medical based product. All of our products, we recommend, you know, we have for example, a 10 milligram capsule, and so the physician will determine with the patient how many milligrams per day that patient should receive for his or her diagnosis. There's also things like different strains that we'll start talking about. There's indica and there's sativa, and then there's a hybrid, and so those have different effects. It's a daytime or a nighttime effect depending on if a patient needs it for sleep or if a patient needs it for appetite stimulation, et cetera. So it really does come down to and start with that patient-physician relationship, and we see our job, quite frankly, as making sure that we have the product line to support what physicians are asking for and what patients need in this emerging market.
So as she's talking about those different strains, would it be completely different for one patient than it would for the next?
Yes, it could be. And that's what's special about what we do at Access Marijuana RX, is that we've got a whole team of people that are constantly monitoring our patients. So we have a very hands-on approach where we're in touch with our patients every several weeks to make sure that the doses that we're starting with are effective, and if not, we're titrating and adjusting those doses if the route of administration is appropriate for that patient and that patient's needs. And it's interesting to know that the different routes of administration have different biological effects. For example, inhalational approach, whether it's vape or combustion, although combustion is not legal in the state of Florida, is the fastest onset of symptom relief that a patient can experience, with the sublingual tincture being the second fastest onset. So we take those things into consideration, as well as the patient's pre-existing medical conditions. If somebody has a diagnosis of COPD or previous lung disease, we'll probably avoid any inhalational method of delivery and go to an alternative route. So those are the things that we try to take into consideration and monitor with our patients.
I know a lot of parents worry about the idea of edibles, as they're called, becoming candy-like or something that could be accessed by a child. What do either of you have to say to that?
I would just say that currently, in current statute, all of our products are in child-resistant containers, and they're appropriately labeled. We have strict prohibitions related to imagery that we can use, and so forth. So I do believe that both lawmakers and then as a business owner, we do have a cautious eye to make sure that we are not doing or providing a product that would be attractive to a child. I think that I personally believe that edibles have their place. I certainly understand the cons, but I think that when you're talking about a person who's in terminal hospice care, who is on a ton of medication and lots of pills and lots of IVs and so forth, and you're looking for something to help that patient sleep, maybe having a square of chocolate is more appropriate and more palatable than let's take another pill, or Grandma, here, I'm gonna introduce you to vaporizing, at 85 years old. So I think that everything is time and place, and I think that as long as it's done in a responsible way with appropriate packaging, appropriate warnings, I think that there is a place for that within Florida's medical marijuana landscape.
I think that the Florida legislators are being very responsible about this. They're listening to the demands of the public, and the public have spoken very clearly that they do not want products that are appealing to young children. They want to avoid that, and they're really taking that into consideration. I'm working with a couple of the legislators that are involved with writing new legislation right now, and that's one of the issues that they're going to make sure is written into the new rules and regulation coming up, as well as many other things. And some of those other things I think are really important from a medical standpoint. Standards of care of medical therapy for cannabis therapy. Those aren't really well defined right now.
Right.
So those are some of the things that we're working on as a team to try to make sure is done correctly and responsibly.
Yeah, still a lot to see. Well, thank you both so much for joining us on Flashpoint today. We'll be interested to hear how things progress, and we'll be right back with more news and weather in just a few minutes.